Hello and welcome to Workers' Comp Unwrapped, the podcast that simplifies workers' compensation for physicians. So, let's get started. Welcome to Season 3, Episode 23 of Workers' Comp Unwrapped, with Anique, your host, and Angela, our guest, who has 15 years of experience in the industry. Today we are talking about holiday injuries and workers' comp, what trends tell us. We're going to explore the seasonal claim patterns, why falls, stress, and temporary worker claims spike, and how providers should respond.
It is definitely that time of year again, isn't it?
It absolutely is. And, we received some fascinating material that really details the unique risks and the administrative chaos that happens in workers' comp during the holidays.
Chaos is the right word. That whole period from, late November through early January, it just fundamentally changes how work gets done.
And that's really what we're here to talk about. It's not just about, more cheer, it's about more risk. We're diving into that high-stress time where staffing changes, the workload just explodes, and all the normal routines they just break down.
And that breakdown is the core of the issue. When the dynamics of a workplace shift that much, when you have longer shifts, new people, doubled production goals, the injury risk goes right up along with it.
So our mission for you, the listener, is really two things. First, we're going to unpack these specific seasonal patterns. Why do slips, fatigue, and temp worker claims spike so consistently?
And second, and this is probably the most important part for your practice, we're going to detail the documentation playbook, the things providers absolutely must do to prevent these predictable administrative disasters.
Okay, let's start with that idea of a risk multiplier.
Mm-hmm.
Why does the end of the year just inherently create a more dangerous environment for workers?
Well, if you look at the operational side, it's a perfect storm, really.
A perfect storm how?
You've got increased production demands, much tighter deadlines. This means you're going to see extended shifts, even mandated overtime. The sheer volume forces people to move faster.
And you're throwing new people into this pressure cooker, right? The seasonal workers?
That's the next huge piece. You have this influx of temporary staff who often get a really rushed, limited onboarding process.
And let's not forget the environment itself. I mean, the sources point out that weather hazards like rain, ice, even just less daylight, they all contribute.
Exactly. So you're asking people to work longer, move faster, often in darker, slicker conditions. It's a setup.
But it's not just the job site. There's a human element here too, isn't there? Workers are juggling so much more outside of work.
Oh, absolutely. That cognitive load is critical. Employees are managing, travel plans, financial stress, family stuff. Their head isn't fully in the game, even when an injury is clearly work-related. That distraction affects focus, it affects reaction time.
So you have this operational pressure cooker combined with a distracted worker. It's a recipe for a claim.
It really is. The chaos is predictable, so the response has to be too.
Okay, so let's get into the specifics. You mentioned 3 distinct injury patterns that always spike this time of year. Let's start with the first one.
The first one is the most deceptively simple one. Slip, trip, and fall injuries.
Right, but those happen year-round. What's so special about the holidays? Are people literally slipping on wrapping paper and tinsel?
If only. No, the risk shoots up because all the contributing factors get amplified. Sure, outside you have icy walkways, but inside the problem is clutter. Inventory is overflowing, you have temporary storage blocking pathways, and everyone is just rushing. Rushed movement in a cluttered, maybe poorly lit area, that's a guaranteed fall.
And what are the typical injuries that result from that kind of fall in December?
We see a lot of low back strains, knee and ankle sprains, and very commonly shoulder or wrist injuries, from trying to brace yourself during the fall.
So wait, you're saying that one of the simplest injuries, like a sprained ankle, can actually cause the biggest administrative problems?
That's exactly it. They seem straightforward, but because of the holiday chaos, you get delayed reporting. The worker thinks, oh, it's not that bad, and then files a report 2 days later. Or the documentation is just incredibly vague. If the initial report just says, fell at work, that can lead to a 6-month fight over the mechanism. That's where simple injuries hide the worst administrative failures.
That makes a ton of sense. Okay, what's the second pattern we see?
The second is the rise of fatigue-related issues and cumulative trauma complaints.
And where are we seeing this the most?
This is a huge issue in those high-volume sectors. Think retail, logistics, manufacturing, even healthcare. And we're not necessarily talking about formal stress claims. It's more about the physical symptoms of just being exhausted.
Like what? What does that look like?
Profound muscle tension, headaches, slower reaction times, and a big one is flare-ups of pre-existing conditions. that old back injury suddenly starts screaming again because of the sheer volume of work.
You mentioned cumulative trauma. How does the body just sort of break down under that holiday pressure?
Well, the sources show a direct line between big jumps in overtime and these repetitive task injuries. So imagine a warehouse worker who normally does 30 lifts an hour. During peak season, they're suddenly doing 60 lifts an hour for 12 hours straight, 6 days a week. The body just doesn't get time to recover, and things like tendonitis or carpal tunnel just accelerate like crazy.
Now, when a claim like that comes in, and the main complaint is fatigue or muscle ache, what is an adjuster looking for? We always hear about objective findings.
That's a crucial point. An adjuster needs proof that it's not just a subjective feeling of being tired. They need objective findings, specific, measurable physical symptoms.
So not just, I hurt.
Exactly. They're looking for documented muscle spasms, a measurable loss in range of motion, actual swelling you can see and feel, or, clear imaging results. If a provider only documents the complaint without the objective proof, that claim gets flagged for review instantly.
That clarity is so important. All right, let's hit the third major trend. Injuries to temporary and seasonal workers.
Yes. These workers are the backbone of the holiday surge, but their risk profile is completely different and it's much higher.
Why is that?
The research is really clear on this. It comes down to a few simple things. They have limited training, they're often unfamiliar with the job duties, and they're thrown into these high-speed environments with no time to get used to it.
Right, so you see things like improper lifting, misusing equipment, that kind of thing?
Precisely. And the administrative failure here often starts with the employer. Their HR team is on a skeleton crew too, so the documentation of what that temp worker was even hired to do can be really vague. That lack of context just complicates everything downstream for the provider.
So if these three injuries, the falls, the fatigue, the temp worker claims, if those are the symptoms, what's the actual disease here? It sounds like it's the process itself breaking down.
That is it, 100%. The biggest challenge for a provider isn't treating a wrist sprain. It's trying to navigate the predictable administrative breakdowns that happen when chaos takes over.
So what are those common failures we see every single year?
It's a consistent list. Vague injury descriptions because staff is rushing, missing job duty details, which is so critical for temp workers.
And delays, I'm guessing?
Huge delays.
Yeah.
Delayed initial evaluations because the clinic has holiday hours, and then inconsistent progress reporting, which can completely derail treatment authorizations.
And this is a really high-stakes point for anyone listening. Holiday hours and staffing shortages do not pause the regulatory clock.
Not at all. That timeline is completely unforgiving. And that's where critical deadlines slip, which creates compliance risks and litigation that you'll be dealing with well into the new year.
Okay, so this sounds pretty challenging. Let's get practical. We need the documentation playbook. What are the essential things providers have to do to avoid these pitfalls?
There are 4 key responses. First, and this is the most important, you have to strengthen your initial documentation. Holiday injuries need exceptional clarity.
So you need more than just what happened. You need the why and the how, right? In the context of the peak season.
Exactly. You need the detailed mechanism of injury. You need to document the workplace conditions. Was the floor cluttered? Was it icy? What specific job was the person doing?
And you have to document those contributing factors, like being on hour 11 of a 12-hour shift.
Yes. A bad note says, patient fell at work. A strong note says, patient slipped on condensation near a temporary storage unit while lifting a 30-pound box 11 hours into a mandated 12-hour shift. That level of detail is non-negotiable.
Okay, what's number 2?
Number 2 is to be incredibly precise with work status and restrictions. Employers are desperate for staff during peak season, so there's immense pressure to get people back to work quickly.
And if those restrictions are too vague, you're just asking for a re-injury.
You are. The restrictions have to be clear and functional. So instead of no lifting, it needs to be lifting limited to 10 pounds maximum and avoiding all repetitive overhead reaching. Specificity prevents disputes and protects the patient.
Makes sense.
Third, you have to track your reporting timelines like a hawk. This is just about internal discipline. Holiday closures do not extend regulatory or payer deadlines.
We're talking about things like RFAs, requests for authorization, right?
Yes. If an RFA isn't sent on time, a denial can become an automatic approval in some places just because of non-compliance. You have to anticipate the holiday lag and build in a buffer.
And the fourth and final point.
You have to expect higher scrutiny on temporary worker claims.
Why is that?
Because of all those risk factors we talked about, the rushed training, the unclear duties, and unfortunately, a higher potential for questionable claims, adjusters just look at them more closely.
So the documentation has to be crystal clear. Their employment status, their specific job role, and those objective findings we mentioned earlier.
Without that, the utilization review process will almost certainly push back and you'll get treatment delays.
Okay, so let's give our listeners that aha moment. Let's pull back the curtain. When an adjuster gets a claim filed during this peak season, what are they really looking for? What are the red flags?
They have a pretty defined set of things that trigger a closer look. The number one thing is delayed injury reporting.
Because it makes them wonder if it really happened at work.
Exactly. Did it happen over the weekend and you just decided to report it Monday? It immediately raises questions.
What else?
Those generic or vague injury descriptions we talked about, fell at work, is basically an invitation for a denial. They also look for fatigue-related complaints that don't have any of those objective physical findings.
So if it's just, I'm tired from working 60-hour weeks, but there are no measurable symptoms, that's a tough claim to support.
Very tough. And finally, they pay very close attention to cumulative trauma claims that are explicitly tied to documented excessive overtime.
Because the payer knows the pressure is on.
Absolutely. They know. And they're going to look very closely at whether the employer did anything to mitigate that risk, like providing rest or rotating duties.
So this doesn't mean the claims aren't legitimate. It just means your documentation has to be specific, consistent, and completely defensible from the very first minute.
That's the whole game. Look, holiday injuries are common. They're going to happen. But the documentation problems, those are entirely preventable.
That documentation discipline becomes your number one risk management tool when everything else is chaotic. It's how you protect the patient and your own revenue cycle.
Exactly. Providers who see this coming and tighten their processes can stop these predictable issues from derailing their whole first quarter.
And for you, the listener, here's a final provocative thought to consider. If we know that external holiday pressures are driving worker distraction, how can a provider effectively document that the patient's momentary lapse in focus and not a systemic failure of the workplace environment was the real root cause of the injury? And how does that kind of documentation protect an employer from long-term liability? Something to chew on until next time. Thanks for listening to Workers' Comp Unwrapped. If you found value in today's episode, subscribe and share with fellow doctors. Stay informed and keep making a difference in your patient's care.